Hello, my name is Thelma.
My name is Maria.
And my name is Sigurós, and we're going to talk about the TV show Grey's Anatomy.
Grey's Anatomy is a drama-centered TV show that is based on the personal and professional lives of 5 surgical interns and their supervisors. The doctors of Grey's Sloan Memorial Hospital deal with life or death consequences on a daily basis. It is in one another that they find comfort, friendship, and at times more than friendship.
She's been like this a while.
I had some bad chicken salad from the cafeteria.
No, you didn't.
Smidge?
I know you don't want it, but we need to put it in an energy tube. We need the nutrients.
No, please. I hate that thing. It hurts so bad, and I can't sing.
I'm sorry, but the anti-nausea meds aren't working. It's the only option.
I need you to get me some weed.
Excuse me?
I think she means marijuana.
I know what she meant, and the answer is no.
But it's legal in Washington.
Under 18.
I'm talking about medical marijuana.
You've been Googling.
There's an oil. It won't get me high. All I need is authorization from the hospital and my primary physician.
It eases the pain, nausea. It's been shown to help patients on chemo and PTSD.
Marijuana itself has more than 100 active components. THC is the chemical that causes the high that goes along with marijuana consumption. CBD dominant strains have little or no THC, so patients report very little, if any, alteration in consciousness. Patients do, however, report many benefits of CBD, from relieving insomnia, anxiety, spasticity, and pain to treating potentially life-threatening conditions such as epilepsy. The most common use for medical marijuana is for pain control. Part of its allure is that it is clearly safer than opiates. In particular, marijuana appears to ease the pain and multiple sclerosis and nerve pain in general.
Still beat if nothing.
19 seconds. Charge to 300. 27 seconds. Charge to 360. Come on, Katie. 49 seconds.
It's 60 seconds. You're supposed to admit another.
A crash cart is defined as a set of trays, drawers, shelves on wheels used in hospital for transportation and dispensing of emergency medicine at the site of medical surgical emergency, for life support protocols to potentially save someone's life. The cart carries instruments for cardiopulmonary resuscitation and other medical supplies, while also functioning as a support litter for the patient. The contents of a crash cart vary from hospital to hospital, but typically contain tools and drugs needed to treat a person in or near cardiac arrest.
Fraction is at 30%, which is why we have to do this today. Do you have any questions before the surgery?
This surgery shall slay the dragon forevermore.
He means the ECMO machine. They call it the dragon.
Because dragons can be slain. For the right night, the right moment, they can only...
ECMO machine, extracorporeal membrane oxygenation, or ECMO, is a therapy that adds oxygen to the blood and pumps it through the body like the heart. The process takes place outside the body. ECMO is like a heart-lung machine used in heart surgery and can be used for longer periods of time. ECMO temporarily takes over the work of the heart and lungs so they can rest and heal. ECMO is used when usual treatments are not working. ECMO does not cure heart or lung disease, it only provides time for the patient's heart to heal.
It's minute, but it's there. It's a subarachnoid hemorrhage. She's bleeding into her brain. She could have gone through her entire life without it ever being a problem. One tap in the right spot, next spot. Exactly. Now I fix it.
An angiogram is a diagnosis test that uses X-rays to take pictures of your blood vessel. A long flexible catheter is inserted through a blood stream to deliver dye in the arteries, making them visible on the X-rays. This test can help diagnose stroke, aneurysm, malformation, tumor clots, and arterial stenosis. In Greece, they use this test to analyze an aneurysm in the girl. Angiograms are generally safe. Complications occur less than 1% of the time. However, there are risks with any test. Bleeding, infection, irregular heartbeat can occur. More serious complications such as heart attack, stroke, and death can occur, but they are uncommon. Bypass machine. The heart-lung machine is also called a cardiopulmonary bypass machine. It is commonly known as a heart-lung bypass machine. It is a device that does the work of providing blood to the body when the heart is stopped. In most cases, the machine is used to perform serious procedures that require the heart to be stopped. Patients are on the pump only as long as it takes to stop the heart from beating, complete open heart surgery, or produce on the lungs and restart the heart. Unfortunately, there are some risks in open heart surgery. For example, the patient in Greece died in the surgery.
So, in conclusion, all the technology we have in our hands today are saving lives all over the world. Our body is so perfect, everything works together, and if something in our body fails, for example our kidneys, we have technology and knowledge to fix it. We have machines that breathe for us, pump our blood throughout our body, and we have machines that makes our heart beat on itself. That means that the future technology in medicine is unstoppable. Personally, I think that we should first perfect our present work so that there would not be any risk factors doing the procedures or using those machines. And that is because all those procedures and all those machines that we have in our hands today include risk factors. It could be from losing our memory, be paralyzed, or just anything you can think of. And I think that we should first perfect that before moving on to the next step in medicine technology. We have knowledge to operate on a human being, to go inside your body and fix a problem. We have so many researches about how to do certain procedures, but still some procedures have never been done. And that is because there is still so much we don't know about the human body. But on the other hand, there has been a tremendous development in medicine technology, and our next step is to develop surgeon robots. They would do their work perfectly without any complication. But on the other hand, they can't think ethically like people, and they can't take rational decisions. So we have a question to ask ourselves. Are we going too far with our technology? Are we making the right decision by trusting a computer with our life? And is there another way?